So in this video, we'll be looking at healing of open wounds. And the case that we have here is a Rottweiler dog breed that was heavily beaten by two German Shepherd dog breeds. Okay, and Rottweiler happens to be the second most aggressive dog breed in the world after Pit Bull. But this dog was overpowered by two German Shepherd dog breeds. Okay, so they created this German Shepherd dog breeds. They beat this dog and they created a large extensive wound on the body of this Rottweiler dog breed. Okay, so the neck was severely affected, as you can see in this video. The head was affected and all over the body. And after some days, the wound started producing pus. And the reason for that pus is because bacteria have already colonized the wounds. There's this type of bacteria they call pyogenic bacteria. Pyogenic bacteria, they produce pus. So pus has already started, coming out from the wounds, and the wound started smelling. The owner of this dog had to call me. So when I came, I started my treatment. But my first focus was to take care of that pus that the wound was producing. And I already know that the reason for the pus is because of bacteria, pyogenic bacteria. So what I did was to give a long-acting antibiotics, oxytetracycline, long-acting oxytetracycline. That is what I injected. So I was doing this injection anytime I come, and I was coming once in 2 days. So, and this long-acting oxytetracycline, it causes tissue irritation. Okay, so I was giving this drug through the intramuscular route. So once you give it through the intramuscular route, the next day we just come and you see that the dog is limping, its leg. So because of that, for me to avoid that, what I was doing was I was mixing the LA, the long-acting antibiotic. I was mixing it with dexamethasone, which is an analgesic, which has an analgesic property and also has anti-inflammatory property. So it's going to counter any effect of pain that will lead to that dog limping. Okay, because LA, that is long-acting oxytetracycline, causes pain when you inject it in dogs. So I was mixing the two and I was injecting it um, in one injection site. All right. So this is what I was doing. So once I inject it, my major focus was to take care of that bacteria that was producing the pus. So if I inject it, now I start dressing the wounds. So the first thing I do is I apply my hydrogen peroxide. Hydrogen peroxide is going to help you know whether the wound is infected or not. So if it is infected with bacterial organism, once you apply your hydrogen peroxide, you see the wound producing foam. You will just see it producing foam. That is to show you that the wound is already infected with bacteria. Okay, so once you pour your hydrogen peroxide and it produces foam, know that it is infected with bacteria. So after the foam, I will use normal saline to flush off the foam. Then I will now use my cotton wool soaked in alcohol, normal alcohol or methylated spirit. Okay, so methylated spirit and alcohol, they are just the same thing. The difference between methylated spirit and alcohol is that they added methane in methylated spirit, okay, to discourage people from drinking it, but it's just the same thing. So I soak my cotton wool in a methylated spirit and I use it to dress the wound, to clean up the wound. Okay, so after doing that, I will apply cicatrine powder. Okay, I will apply cicatrine powder, but before the cicatrine powder, I will apply wound healing oil. So after the wound healing oil, I apply my cicatrine powder. So the sequence is this: my hydrogen peroxide. After that, I use normal saline to flush it off. After that, I soak my cotton wool in an alcohol and wipe the injured site, the wound site. After that, I apply wound healing oil. After the wound healing oil, I apply my cicatrine powder. All right. So that is what I was doing any day I go. So I was going there every 2 days. For the first week, I was going every 2 days. Then for the second week, I was going once in 3 days. Okay, and each time I go, I will inject them. I will inject the dog with antibiotics to take care of the bacteria that was producing pus. Because if I did not take care of that bacteria producing pus, the infection will persist. The wound healing will take time. It will take time for it to heal. Okay, so I was doing that, and after like the third time or the fourth time that I came for the wound dressing, When I applied my hydrogen peroxide, I discovered that the wound was no longer producing foam, and that was when I stopped giving them. Um, I stopped injecting my antibiotic because it was no longer producing foam. That is an indication that it's no longer infected, and the wound healed completely.